Welcome to the Great Toe Arthritis Treatment Guide. I'm going to tell you about the stages of great toe arthritis, also called hallux limitus, and what to do about them at home. So here's what it looks like on x-ray. Here you have normal joints with a little bit of space. Usually you're supposed to have at least 2 millimeters. Right here you can see in your second, third, fourth toe. But in the big toe, it's all gone. You can see it's white, it's sclerotic. That means the bone's breaking down and it's attempting to re-heal itself. So, what are you going to do about this? And how do you know how bad it is? Well, what happens is as you start walking around, the cartilage starts to break down in the joint right here. And then the bone starts to rub, and see this joint space right here? The bone starts to rub, which would normally be protected by cartilage, and it becomes kind of spiky and uneven and unpleasant, I guess is a good way to see it, until the joint fuses and kind of locks in and you lose motion. Now, the reason I say there's 4 stages, because initially in the first stage there's no real bone damage, it's just sore, the muscles are irritated. Then the second stage, the muscles became tight, you decrease joint motion, but still no bone damage. But then third stage, you start to develop a little bit of bone unevenness like this. The cartilage is gone. And then by the fourth stage, it's almost fused together like this, and you can barely move the joint at all. So, what you have to consider is, do you have arthritis pain? Did it sound like that? If not, then come to this guide and I'll give you the list of the most common toe pain causes and what to do about them. But if not, keep watching this guide. So here's what arthritis is. Normal joint like this, basically over time as you move it, the cartilage breaks down, the joint becomes uneven, you get spurs, and you can't move it and it hurts. What can you do? First stage, you gotta get the inflammation down. You can do this at home. I'm a big fan of anti-inflammatories. These aren't pain medications like narcotics. These just decrease the immune system from attacking the joint and making it red hot and swollen. It helps you heal. So get on a course of those for a week or two to decrease the pain, and talk to your pharmacist or doctor about arthritis dosages, because they are a little bit higher than just like the headache dosages that you normally take these for. But you need to be at these levels to help your body heal. Number 2, start icing these things 15 to 20 minutes at a time. I know icing sounds unpleasant, but it'll dull the nerve sensation and decrease the inflammation, not just allowing it to feel better, but to heal better. Here you can massage the joint out, roll tennis ball under your big toe, get some motion up or down, not to the point where it hurts. And then right here, the huge monster thing you can do is get some over-the-counter orthotics. I'm a big fan of power steps personally, but this will prevent abnormal motion in your big toe, and I promise this is the best $25 you're going to spend in your life. And once the inflammation goes down, that's going to take about a week or two. You want to eventually look into getting some good shoes, maybe for longer term, some custom-made orthotics, but if you don't have insurance, stick with the over-the-counter. You want to look into getting physical therapy, work out those tight muscles. This is especially important in the later stages. In like stage 1, where you have full motion but it's just sore, you're probably okay without physical therapy. And stretching. Get your hamstrings, your calves, the bottom of your foot stretched out. This is going to help you for all foot pain. This is the best cheap thing you can do. Orthotics and stretching. You got to do those 2 big things. And the reason you want to do all this stretching is normally you're supposed to have heel contact, mid-foot stance, and then toe off. All of those are in about 1/3, 1/3, 1/3. So all about equally. But if you have tight muscles, you're walking more on the front of your foot, or if something else is injured like back problems, you're hitting more on your heel. So just as an example, your biomechanics could be off. So you definitely want to stretch out all your tight muscles, look at your old injuries, and get walking normally again. Even just wearing good shoes or orthotics could help you do this. And then if you're still in that last 5-10% stragglers where the pain has not gotten better, this could be especially in the stage 4 people with severely arthritic bone. You may need surgery to either remove a joint here and fuse it together, or even in your big toe. So you want to see your podiatrist and get evaluated. And another thing that really helps long term, especially for surgical healing, losing weight and stopping smoking so you can get your body healed. Just getting in great shape in general. Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.